Irbesartan is a medication primarily used to treat high blood pressure, hypertension, and to protect the kidneys from damage due to diabetes-related complications. It belongs to a class of drugs called angiotensin II receptor blockers (ARBs), which work by blocking the action of angiotensin II, a hormone that constricts blood vessels and increases blood pressure. By blocking angiotensin II receptors, irbesartan helps to relax blood vessels, allowing blood to flow more easily and reducing blood pressure. This helps to lower the risk of heart attack, stroke, and other cardiovascular events associated with hypertension. In addition to its blood pressure lowering effects, irbesartan is also used to treat diabetic nephropathy, a type of kidney disease that occurs in individuals with diabetes. By reducing blood pressure and protecting the kidneys from further damage, irbesartan helps to slow the progression of diabetic nephropathy and preserve kidney function. Irbesartan is typically taken orally, once daily, with or without food. The dosage may vary depending on individual patient needs and the severity of the condition being treated. Common side effects of irbesartan may include dizziness, headache, fatigue, and diarrhea. More serious side effects such as allergic reactions, kidney problems, and low blood pressure are rare but can occur. As with any medication, irbesartan should be used under the guidance of a healthcare professional who can assess individual patient needs and monitor for potential side effects.